Oh, I really love this one because there's so many misconceptions around it. I even have like still a little bit of misconceptions around it. What do you think, Emily?
So it's definitely one of those things that people aren't always 100% sure about. So emergency contraception is also known as Plan B or the morning after pill. Basically, it's a type of contraception that you take after you've had unprotected sex when you don't want to get pregnant. So it's actually a bit misleading to call it the morning after pill because you can actually have it up to 5 days after the unprotected sex. However, the sooner you have it after unprotected sex, the more effective and the more likely it will work in preventing pregnancy. A lot of people are worried that you can only have it once, or that it's, really dangerous, or that it's the same thing as an abortion, but that's not true. What it does is that it actually stops your body from releasing an egg, so basically it can't get fertilized. So basically there's no long-term effects on your fertility in the future. There's no long-term health issues, there's no links with cancer or anything like that. So emergency contraception is definitely something that you might want to think about if you've had unprotected sex and you don't want to be pregnant. You can actually buy it without a prescription at most pharmacies.
I think that's one of the most important things, that you can go to a pharmacy and ask for it and you won't be judged. There will be no record of you and anywhere else, and you don't require to see a doctor per se to actually go and get it, which is really important.
That's a tricky one. So it basically depends, because there's so many different types of birth control and there's also so many different types of insurance cover. It depends a little bit on what you've got and what you want. So something like the pill, that's going to need regular scripts that you're going to have to get every few months. Something like the IUD, that could actually last you up to 10 years. So it really depends, sort of, when you talk about cost, if you're looking at short-term or long-term cost, if you're wanting something that will last a really long time that you can just forget about, or if you're happy sort of getting something every few months, like the pill or like the injection. So there's definitely places that can charge a bit more than others, depending on what sort of services they offer. I think the best thing to do is basically check with your insurance provider what is covered, and then you can have a chat to someone like us and we can point you in the right direction to find somewhere that does do direct billing for contraception options.
And also, it's always best if you actually ask your GP. They will always know and they will help you to actually find the right birth control within your budget. So they will always work with you. Therefore, it's always good if you talk to your GP about your budget constraints, about what are your issues, everything that you need to talk about in terms of your health, to make sure that you actually get the right treatment.
That being said, there's a lot of clinics that actually give out condoms for free. So at the end of the day, condoms are always a cheap and easy option.
This one is a tricky one. There's always this tiny little chance of you getting pregnant. It's not your fault. Even if you do absolutely everything right and you have taken care of yourself like the best way you can, there's always this tiny little risk of you still getting pregnant.
Yeah, that's right. And I think it's really important to know that even if every single couple in the entire world used contraception 100% perfectly every single time they had sex, there would actually still be around 6 million unplanned pregnancies every year. So that's not to say don't use contraception. So obviously, please keep using contraception, because there's some contraception methods that are much more effective at preventing pregnancy. So things like the implant is like 99.9 something percent effective at preventing pregnancy. So yeah, if you do have an unplanned pregnancy, there's always options for you in Victoria. In Victoria, abortion is safe and legal, and that's something that a lot of international students are often quite worried about, and we do get a lot of calls asking about abortion access in Victoria.
What about other parts of Australia?
Basically, there's different state laws for different states and territories, meaning that you can access abortion across Australia, but depending on where you live, what that looks like might be slightly different.
Every time I hear this, it just makes me really sad. Like, I hear it a lot, and it makes me sad because when the topic around abortion is very controversial, there's a lot of taboo around it. And it damages a lot of women in general. So it makes me very sad whenever I hear this myth.
So that's a really, really common misconception. In Australia, abortion is safe and legal, and it's done through trained health professionals and qualified services. So basically, in Victoria, there's two ways of accessing abortion. One is through medication, and two is through surgery. So with the medication, you actually take 2 lots of medication and you have the abortion at home, basically. So with accessing the medication, you can go to a GP who's done the training, or you can go to a private clinic to access it. With the surgery, that needs to be done in a clinic or in a hospital, and you're put under anaesthetic, and it's a really quick and simple procedure, and there's very, very low risks of complications for both of them. They don't affect your ability to have kids in the future. They don't affect any sort of other long-term health conditions into the future. The only abortion that's unsafe is generally the ones that are illegal. So I'm saying that in light of what's happening in different places around the world, where abortion access is a lot more restricted compared to Australia.
I think that it's also important for people to know is that if you go to an abortion clinic, we don't really have, like, there's not really a specified clinic, like, you can only go here for abortions. Like, a lot of clinics do a lot of many different procedures. So nobody will always know that, oh, you're going to get an abortion because you're going to this clinic specifically. And that's one of the things, like, I feel like I really like about Australia, because it makes people feel safe. And nobody's going to stand outside the door telling you how horrible you are, how terrible you are, making you feel guilty about yourself.
Yeah, like you said, there's a lot of other services that these places do offer. So they might be going there for a cervical screening, they might be going there for contraception, they might be going there for an abortion, but you can't really tell because it's none of your business, basically. So at the end of the day, abortion is just a healthcare procedure, just like any other, and it's something that you're entitled to access. And unfortunately, there's still a lot of myths and stigma and difficulties in accessing it all around the world. So that's still sort of something that we all have to work on.